My name is Cristina, and I'm a peritoneal dialysis nurse here at DaVita. I've been a registered nurse at DaVita for 7.5 years. The first half of that has been with in-center hemodialysis, and the second half has been with PD. We're gonna go into the first room on this side, okay? So I wanted a new challenge when I switched from in-center to PD. I loved in-center, I loved seeing the patients, I loved the job, but I just wanted something different. I wanted a new challenge and a different way to do dialysis. So the biggest difference between the two is that when you're in-center hemodialysis, as the nurse, you do all of the things. So you're in control of that situation. Whereas with PD, you're relinquishing that control. You can train the patients and you're doing all you can to let them know how to do it at home. But I don't have eyes on them 24/7. So it's really a team effort between me and the patient. So we're gonna get your vitals first. Peritoneal dialysis allows our patients to do the treatments in the comfort of their own home. We bring them in, we train them and or their care partners. We cover everything that we could possibly cover, anything that could go wrong, how to do things on the normal basis, so they can feel really comfortable to take the care into their own hands and do their treatments all at home. So at the very, very beginning of training, like when you first started, they do about 8 days of training, her and her daughter. It's a combination of information on the computer education that way, and then education as far as problem solving, situational things if things were to go wrong, and how to do their treatments, whether it's manually, meaning using it with an IV pole, no electricity, or using a machine, a cycler. They can do that, they hook themselves up at night. Even though it's me as their primary nurse, it's still very much a team effort with your fellow PD nurses because there aren't very many of us. So we're like a little community in ourselves, and we are very specialized. So not everyone knows the ins and outs of it like other PD nurses do. So even though we have our own programs and our own clinics, we very much work together. The flexibility for me is wonderful because you don't see that with a lot of healthcare jobs, especially as a registered nurse. So PD really did allow me to have that flexibility, which is wonderful. DaVita has a lot of wonderful benefits. I was able to utilize the little star gift when I had both of my kids to give me the additional time off, and which was absolutely wonderful. I would recommend anyone to work here. You have career advancement opportunities just at your fingertips if you communicate that. The team is super supportive when it comes to those types of things. The flexibility is wonderful. They understand that you have a life as well outside of work. And I really feel like there's a culture of work-life balance that is just on the forefront of their minds. And I really appreciate that.